Good morning, and thank you for joining our webinar presentation featuring a presentation on Advanced Beneficiary Notice. My name is Leah Anderson, and I am the Marketing Lead at BMS Practice Solutions. Before we get started, I would like to ensure that you have the best webinar experience. If you are listening with your speakers on your computer, you do not need to be dialed in. At the end of the presentation, we will have a Q&A segment. You will be able to ask questions by either typing them in the question box or by using the raise your hand feature. If you do use the raise your hand feature, I will be able to see it and I will send you a PIN code that you can enter on your phone. I will now begin our webinar with a brief introduction of our company. BMS, headquartered in Upland, California, is the nation's leading provider of revenue cycle management services and web-based practice management software for independent outpatient rehabilitation practices. In fact, we work exclusively with PT, OT, and speech practices. To provide some perspective on our experience and market presence, BMS has been operating for over 20 years. Currently, we provide services and technology to over 500 practice locations in 40 states, and we process over 2.2 million claims annually on behalf of our clients through our RevFlow system. One of our service objectives is to be a local vendor to our clients. In addition to our California office, we serve our clients from 5 additional service centers located regionally throughout the United States. At this point, I would like to introduce John Wallace, who will be conducting our webinar presentation today. John is the CEO of BMS and a founding member of the company. As you most likely know, John is a physical therapist, former practice owner, has been very involved with the APTA over the years, and is a nationally invited speaker on therapist coding, compliance, and related topics. Please welcome John.
So today we are going to be talking about beneficiary notification in the Medicare program. Now this topic has been confusing to therapists since its introduction into the program, and it got significantly more complex in January when they basically completely changed how we're supposed to use ABNs, when we're supposed to use them, what modifiers we're supposed to use, and that started with the American Taxpayer Relief Act that was passed in January 2013. Now, the first notifications from Medicare about this didn't actually come out until April. And there was so much confusion from it that Medicare had to publish some other educational pieces in order to help make it clear to everyone what was required. So with beneficiary notification in the Medicare program, the responsibility rests with the healthcare provider to inform the beneficiary when services that are usually medically necessary may not be in a particular case, and then have the patient execute an advanced beneficiary notification form so that the liability for services can be shifted from the provider to the patient. So in order to collect money from patients who have not medically necessary services in the Medicare program, starting in 2013, you have to have an executed ABN, and that ABN has to be executed before the services are delivered. So the changes that went into effect affect the ABNs, the use of ABNs with the therapy cap exceptions program, the appropriate ABN modifiers to use for the cap program, the use of voluntary ABNs, and the use of ABNs for not medically necessary services. So we're going to review all of these today. Now, prior to ATRA, claims above the therapy cap that did not qualify for coverage were denied as in payment, and that balance was always assigned to the patient. So the patient was always liable for services over the cap that did not meet the exceptions criteria. ATRA amended the Social Security Act to provide a limitation of liability. I thought it was ironic that they abbreviated that LOL, so I included that here for your amusement. to provide limitation of liability protection to the patient. So as of this year, when services are provided to a Medicare patient and then are denied for being in excess of the cap, the patient does not, and the patient doesn't qualify for an exception, the balance is assigned to the provider. So you cannot automatically bill the patient for services that are over the cap if you don't have a valid ABN issued prior to treating the patient. So just to say this as clearly as I can, you can't go back and get the patient to sign an ABN after the fact. That is a violation of the rules and would be a serious offense in the eyes of Medicare. So under the current rules in 2013, when a patient receives treatment above the therapy cap, the provider must issue a valid ABN to the patient before they provide services to the patient. The ABN explains that Medicare is likely not to pay for the services above the cap and allows the patient to choose whether or not they're going to receive the services and accept financial responsibility. And we'll actually look at an ABN form and kind of help you understand how to do that. Now, one of the big changes in this program for this year is the ABN modifiers that you use in certain cases. So prior to this year, when billing for not medically necessary services over the cap, we billed the GY modifier because they were statutorily not covered. So ATRA disallows the use of the GY modifier because of the new limitation of liability protections in that act. So when you issue an ABN in the case of services rendered to a Medicare patient who are over the cap, when an exception does not apply, you bill that with the GA modifier now, not the GY modifier. You bill the GA modifier, which is the not medically necessary modifier. Only in this case, when you've issued an ABN with a GA modifier, can you collect from the patient at the time services were denied. So one of the other things that changed was therapy for not medically necessary services. So let's take a second and talk about this, because not medically necessary in the eyes of the Medicare program can mean a lot of different things, a lot of different boxes that weren't checked. So typically, for services to be medically necessary in the Medicare program, you have to have a plan of care that's written by the therapist, and then that is certified by the physician with a physician signature. The patient has a good likelihood of benefiting from the therapy services and meeting functional goals that are identified in the plan of care. If for some reason those medically necessary qualifications for the patient care are not met, then they're not medically necessary, and the patient would be liable in those situations only when you have them sign an ABN form before the services are rendered. Now, Medicare provides 3 example situations in which these not medically necessary service issues could arise. So we're going to go through the 3 Medicare examples. So in example 1, we're going to say the therapy cap is not met. The patient still wants to receive treatment, and in this particular case, an ABN would be mandatory if you wanted to collect money from the patient. So in this particular example, a patient receives $780 in medically necessary services, and the therapist recommends discharge from therapy because all the goals are met. However, the patient requests to continue to receive therapy 2 times per week, even though the services are not necessary. And no matter how many times I proofread these darn things, I always find one typo. So there it is. In this case, you have to issue an ABN to the patient before starting the requested services so that you can collect from the patient. Now, if the medically unnecessary services are billed to Medicare, then you would put the codes in like you always do, and you would use the GA modifier to bill the claims to Medicare. When you bill the GA modifier in 2013, it's telling Medicare the services are not medically necessary, and you are for sure going to get a denial. At that point, if you have a denial and you have a signed ABN in effect, then you can collect the money from the patient. All right, in Medicare's second example, you have the situation where the therapy cap has been met, and the patient wants to continue to receive services, again, the services aren't medically necessary, so an ABN is mandatory. So the patient receives therapy and achieves all goals of the plan of care. The total for the treatment for the calendar year is $1,900. The patient requests that additional therapy even though the therapy is no longer medically necessary. So in this case, an ABN must be issued prior to providing services to the patient that are not medically necessary and before any money can be collected from the patient. Again, if you bill these services to Medicare, you would bill them with a GA modifier. Now, well, in a few minutes, we'll talk about whether you have to bill the services or not. But if you do bill them, you must bill them with the GA modifier. Now, in Medicare's third example, the therapy cap is met, the exception process is applied, there is no ABN. So a patient has been receiving medically necessary therapy and has met the $1,900 cap. But services above the cap are still reasonable and necessary. In this case, the patient qualifies for an exception to the therapy cap. Claims are billed with the KX modifier, and this is attesting that the claims are medically reasonable and necessary. You do not issue an ABN. In fact, you do not ever issue an ABN when you are providing services you think that are reasonable and necessary. If at some time in the future services are denied as not medically necessary, you may not collect the money from the patient. So if a RAC auditor or a Medicare MAC reviews your record sometime after the fact and after you've already been paid for the services and they determine that they weren't medically necessary, you have to repay the money to Medicare and you may not collect it from the patient because at the time you billed it, you felt it was reasonable and necessary. Okay, so this is a very key point. For services rendered above the therapy cap that are billed as reasonable and necessary under Medicare regulations and MAC local coverage decisions, as indicated by the use of the KX modifier, the provider cannot ever transfer the liability to the patient even if the services are denied at some time in the future. This is the primary largest change in the ABN program in 2013 compared to prior years. So anytime you bill services that are medically reasonable and necessary, you may not have the patient sign an ABN, and if they are found to be not medically necessary, then you cannot collect the money from the patient. The provider is liable. Now, in general, when services are not medically reasonable and necessary, they are not going to be payable by the Medicare administrative contractor. Remember, the MAC is the private company that contracts with Medicare that processes and pays Medicare claims. Now, if the beneficiary wants to receive services and pay out of pocket, an ABN must be issued and signed by the beneficiary before services are rendered. And this is true whether you're going to bill the charges to Medicare or not. You must have a signed ABN. Now, for those of you who are either trying to convert to pure cash practice, this is a very tricky thing. And what Medicare wants to avoid is Medicare patients going to providers who are paying cash for services that should be covered under the Medicare program. So whenever you're saying that services are not medically necessary, the ABN form requires you to say why they are not medically necessary. So it is not suitable to say Medicare won't pay for the service because they're not medically necessary. You also have to say why they're not medically necessary. So the patient declined to see the physician and the physician refused to sign the plan of care for the patient because he wanted to see the patient. Now, there are no patient visits required under the Medicare program, but the referring physician always has the option of being able to require a physician visit in order to certify a plan of care. Now, in the case of health and wellness services, the reason for that they would not be medically necessary is that Medicare doesn't cover wellness and prevention services in the outpatient therapy arena. So that would be the reason there. So there would be no plan of care, and it would not be medically necessary, therefore not payable by Medicare, but you still must have the patient sign an ABN even though you're not going to bill the services to Medicare. So the ABN must be completed with a reason why the services are not be considered medically reasonable or necessary. The patient must select one of the three options in section G of the form, and we'll go over that in a moment, and the patient must sign the form. So you cannot collect money from Medicare patients for not medically necessary services without a signed ABN, and that is new this year also. Now, I've had a lot of questions on whether providers are obligated to bill Medicare. Now, obviously, if the services are covered under the Medicare program and you expect Medicare to pay, you must bill them to Medicare. And if you are a participating provider in the Medicare program, you may not collect money from a Medicare patient without a signed ABN. So Medicare beneficiaries always have the right to ask the providers to submit a claim to Medicare for an official payment decision. So this is from the Medicare Claims Processing Manual, Chapter 30, and I have the section number there for you in Section 50. So the beneficiary must select option 1 in Section G of the ABN form if they want you to bill the services to Medicare. If they want to receive the services and they don't want you to bill it to Medicare, then they check box option 2. So here's the ABN form, and if you get the handout for this webinar, there's a full-size version of the ABN form there, and you'll be able to see that. Now, you can download a Word copy of the ABN form either from the cms.gov site or from your Medicare Administrative Contractor site. If you just go to their page, the provider pages in the cms.gov site or the Part B or Part A page of the MAC site and type in ABN, you can download this form. So you can put the patient's name in here and their identification number. You can put your practice name at the top, and you fill in the form. And you just fill in the blanks, right? So A is the notifier, B is the patient name, C is the identification number. A notifier, by the way, is the practice. Okay. Now you don't have to have notifier. You can just put your practice name here if you like. So if Medicare doesn't pay for, and you fill in blank D here, you can take the D out. So you could say if Medicare doesn't pay for physical therapy services below, you may have to pay. Medicare does not pay for everything. Even some care that you or your healthcare provider have good reason to think you need, that doesn't mean they're going to pay for it. We expect that Medicare may not pay for the physical therapy services below, or the occupational therapy services below, or the speech therapy services below. You need to put the services here in the first box here in D, and then you need to give a brief explanation about the reason Medicare may not pay, and then the estimated cost per visit. Oops, sorry. Okay, now we talked about section G with the options. Okay, so here's option 1. I want the physical therapy, occupational therapy, or speech therapy services listed above. You may ask to be paid, but I also want Medicare billed for an official decision on payment, which is sent to me on a Medicare summary notice. I understand that if Medicare does not pay, I am responsible for payment, but I can appeal to Medicare by following the directions on the Medicare summary notice. If Medicare does not pay, if Medicare does pay, you will refund any payments I made to you, less any copays or deductibles. So that's option 1. So in this particular case, if they select option 1, you can collect money from them at the time of service for the services you deliver, but you must bill them to Medicare, and you would bill them with the GA modifier. Now, they can also select option 2, is I want the therapy services listed above, but do not bill Medicare. You may be asked to pay now, as I'm responsible for payment. I cannot appeal if Medicare is not billed. So that's option 2. So option 1, you have to bill Medicare, use the GA modifier. Option 2, you can treat the patient, you can collect the money, and you do not bill it to Medicare, but you still need a signed ABN. Option 3 is I don't want the therapy services listed above, in which case you're done. Then you have the patient sign it and date it, and you must give them a copy of the form. Again, this form's readily available on the cms.gov website and on the websites for the for the Medicare administrative contractor for your area. Now, in the case when you're issuing a voluntary ABN, so for example, when therapists who are not DME providers issue equipment or services that Medicare does not cover, there is no requirement to supply the beneficiary with an ABN. The beneficiary is not required to pick an option in Section G. You can give them the ABN, and we recommend you do that so you have something in writing that you've noticed the patient. Now, you don't have to use the ABN form. You can use a form of your own design for this because this is voluntary. But the beneficiary does not select an option because it's not a covered service. Because it's not a covered service, and let's say they do want you to bill it, then you would bill it with a GY modifier. So they can, as always, select option 2 or option 1. If they select option 1, even though if you've explained to them it's not a covered service and they want you to bill it, you can bill the GY modifier. Of course, you would also do that in cases where you might have a secondary payer or some other insurance company that will pay once you get a denial from Medicare, and you need to get a denial from Medicare even though it's not a covered service. So that part hasn't changed. But we used to use the GY modifier for services above the cap. Now we don't. Now we need to use the GA modifier. Now, as you can see, this training that we've done in this webinar today is typical of the kinds of trainings we do for our clients. We do live trainings. We also have a very robust resource center, which is basically an electronic learning platform where our clients can go in and listen to these trainings whenever they need. It's also very helpful, obviously, if you have new therapists join your company. You can certainly put them in there and they can get their coding training, they can get their compliance training, and training on highly specialized topics like ABNs. Now, the way that BMS can help you in your practice is we take a very consultative approach to help you understand your financials and how you can increase your top line revenue as well as your overall practice income. And we actually do that by looking at some of your historic billing and collections data, and then we can usually be very specific on how we can help you. So remember, what we do is we do your billing and collections for you, everything from soup to nuts. We partner with you on that. We don't make any collection or follow-up decisions on your patients without checking with you first, because we know that every practice has people that they treat that are, relatives or friends of the practice, and we certainly don't want to irritate any of your patients or clients. Our RevFlow technology helps you understand how your business and your practice operates. We do this through our practice management portal, as well as with our scheduling and EMR software. If you'd like to schedule a free demo of any of our applications or see RevFlow work, Leah has instructions for you on how to do that. So if you have questions on today's webinar, or would like to contact us about getting a demo or find out more information about us, you can go to getStartedNow@bmsemail.com, or you can call our toll-free sales line, 877-774-6625. So with that, we will take your questions. So Leah, I'll turn it back over to you to moderate the question and answer session.
Okay, thanks, John. First question comes from Denise Parsons. Does a non-participating provider doing private pay wellness have to have a patient sign an ABN?
Anytime that you're providing not medically necessary services to Medicare patients, you should have them sign an ABN. Now, as a non-participating provider, you can certainly collect money at the time of service from the patient without having a signed ABN for their copay or co-insurance portion of their Medicare payment or for the entire payment. So just remember, as a non-participating provider, you're already making 5% less than the fee schedule allowed amount, and you're limited to what you can charge for covered services to 115% of the Medicare amount.
Great. Our next question is from Janice. I thought if you were a provider, you had to bill regardless. Even if they check option 2, do we have to still bill if we are a participating provider?
You do not have to bill if the patient selects option 2. You do have to have them sign an ABN, but you do not have to bill.
Our next question from Sherry. Just for clarity, we do not issue an ABN at any time for services we deem medically necessary, correct?
That is correct. That's one of the major changes this year. If you believe the services are medically reasonable and necessary, you bill them to Medicare. If they're over the cap, then you bill them with the KX modifier. But in that case, if Medicare says they are not reasonable and necessary, then you may not collect them from the patient. Now, this should sound familiar because this is how all the commercial providers work. So those of you who've heard my trainings over the last 18 months know that Medicare is transitioning to treating claims just like commercial payers. So you're going to see more claims denied as time goes by before they're paid, rather than getting paid and then having to repay them to Medicare, which is what they've typically done in the past. So Medicare is moving from post-payment review to pre-payment review.
Our next question comes from Jody. How do you use the ABN and GA modifier if the patient feels their secondary insurance may cover services if Medicare denies?
Well, that's why you would want to use the GA modifier, because it'll come back denied by Medicare for sure, and then you can submit it to the secondary payer, who will use their own medical policies and claim rules to decide whether the services are medically necessary or not. Now, if it's a supplement and Medicare denies, the supplement is not going to pay. If the patient has a true secondary, then they use that secondary uses their own medical policies and claim rules to decide whether they're going to pay the claim and how much the claim they're going to pay. But in every case that you want to do that, you do need to have a denial from Medicare, and the GA modifier would produce a denial from Medicare for that purpose.
Our next question, Jeff Zimmerman. If wellness is not covered ever, why the ABN? They can go to a local gym and do the same thing, and neither one is billing Medicare. I don't understand the difference.
Well, so in the Social Security Act, it does not specifically say that wellness services are not covered. Wellness services are considered not medically necessary. And the rule is if the services are not medically necessary, then you must issue an ABN.
Okay.
I could expand on something there too. So maybe if I say this, it'll be clear. Okay, if you want to, for example, sell a therapeutic ball to a patient, a Medicare patient, the Social Security Act specifically says that supplies and equipment that are not required to deliver the treatment in the office are not covered by the Medicare program unless you are a DME supplier and Medicare has rules to pay you for those services. Therefore, it is statutorily not covered and an ABN is not required. But because the Social Security Act does not specifically call out wellness services, then the only way that they're not covered is because they're not medically necessary and an ABN would be required. I hope that helps.
Okay, our next question comes from Denise. I see that you've raised your hand. I'm going to unmute you. Denise, do you have another question? Okay, we will move on to Janice. Janice, do you have another question?
No, it was answered about the secondary.
Janice, can you please speak up? We can't hear you very well. Okay, your question was apparently answered. Okay, thank you. Does anyone else have any other questions? Okay, if there are no other questions, or we will conclude the webinar. If anything else comes up, please feel free to email me at landerson@bmsemail.com, and I will have John answer those questions for you. Thank you for participating today.
What do you want to do? I started asking another question, but I